Many of those town hall meetings held across the country have turned into a debate on health care reform, and that conversation has certainly been at the forefront of the news lately. But what can be done at the state level? Well, to talk about that, I'm pleased to be joined by Senator Scott Heidepriem. He currently is serving as Senate Minority Leader and is one of two Democrats running for governor of South Dakota in 2010. Mr. Heidepriem, thank you so much for being here.
Thank you, Drew.
Say, and let me just start by asking you that question. What can be done here at the state level for reforming health care?
Well, there are a few things, but unfortunately, it really is a national problem that demands a national solution. So I think that the administration and the Congress are really going about it in the right way. They're asking the right questions. South Dakota's uninsured numbers are roughly mirrored by the national average. We're actually in a little better shape than the country is as a whole. We do have a substantial number of uninsured South Dakotans. The estimates range from 70 to 90,000 citizens in our state do not have insurance. We can have some effect at the margin. We can increase some of the high-risk pools. We can do some things like that, encourage wellness. But largely, this is a federal, national problem that must be dealt with in that way.
Regardless, when traveling around the state, you were in Hot Springs area, various other parts of West River. What were the conversations like pertaining to health care?
Well, there's a great deal of interest, but what I found is I think the message is getting through that there aren't death panels in this bill, that no one is seriously concerned that someone's going to pull the plug on grandma. I think those are tactics that have been used by people who are opposed to the idea of reform. The real larger question is when you see folks in these town hall meetings holding up signs saying, take your hands off my health care, there's a second question that needs to be asked, and that is, okay, but the status quo right now results in this. Everyone gets health care in the United States. It's just a question of when. Someone who's uninsured ends up in the emergency room, which is the most expensive way to deliver health care in the United States. So we can either step back and take a look at the system as a whole and say preventive care and regular checkups are going to make it unnecessary to end up with that expensive care, which actually benefits the very people who are complaining by saying, take your hands off my health care. Because when someone goes to the emergency room, everyone pays. All the taxpayers in the United States cover that cost. So we really need to get to a system where we encourage wellness and preventive care.
And whether or not the state has any ability to change or reform health care, one thing it can do is affect taxes and what South Dakotans pay. As a gubernatorial candidate, what's one thing you would do on that issue?
Well, I've been really surprised in the last couple of weeks to see all sorts of new tax proposals come out. There's even a tax on health care I've heard proposed. There's a proposal for an income tax. There is a proposal yesterday for a 10-cent increase in the gas tax, and today for a sales tax increase. What I hear from people in South Dakota is, you know, the economy is still in the tank. Let's step back from these tax increases and decide whether this is really the best time to impose new taxes on the people of South Dakota.
Very good. Well, I want to thank you so much for being here to chat with us and spend part of your weekend here at KSFL Action News. I really appreciate it.
Thank you, Drew.
Thank you.